Hi there, this is Dr. Johnny Trong. I'm here with my wonderful patients. They're going to share with you some of the, the improvements they've experienced from Upper Cervical Chiropractic. So, first off, could you let me know, let people know what it is that your mom came in for, and what was the challenge that she came with?
We first of all came in here because she was having a lot of dizzy spells. She was having arm pain, she was having back pain, her legs, her feet, sometimes she was shuffling, and that's gone away because I constantly have to tell her, raise your feet, walk. Her jaw was a little bit crooked, off probably about 1/4 of an inch, maybe a little bit less, and I would notice it, and she wasn't able to chew right. So after the alignment, she still has soreness in her back, but the dizziness has gone. She has not had one dizzy episode in a week, where before she had it on a daily basis. And, I give her medication, like a Dramamine thing, just to get the dizziness away, but it still was a constant. But I felt that this was kind of our last resort, that if this part of her neck was not fixed, the rest of it was never going to be aligned. And she's 88 years old, so I did not want to have her on medications. So the only medication she's on is her blood pressure medication, but I'm told, this could even help that. And she used to fall a lot, and she was unsure of her footing, and now all of that has gone back into place. She did have a problem with incontinence, constantly going to the bathroom at night, 5-6 times, and during the day as well. Now, since she had this adjustment, she goes once or twice a night, but she's able, and she doesn't go as much as she did, but she's able to go back to sleep. And during the day, she'll go, the normal amount that a person would go, 3-4 times, but not where she has to run because she's not going to be able to make it. So there's been a lot of improvement.
Yes. You mentioned about her neck pain as well.
The neck pain, she was unable to turn her head to the left or the right, or bend it over this way. Where now, the mobility in her neck is almost 100%.
The neck pain's gone.
And the pain, no pain in her neck. She has the normal amount, on her arms, but like you say, it's part of it starting to function and come together and work well. Right. But all in all, if you have never been for this upper cervical adjustment, you have to go. And I guarantee you that if you're not completely off of your medications, you will decrease it quite a bit, because the adjustment does so much for your whole body. And on the way home after the adjustment, within 5 minutes, she felt like her eyes had opened up. She says, guys, I feel like my eyes have really opened up.
So, you mentioned something about the ringing in the ears too?
Yes. Okay. Before she had the ringing in her ears really bad, where she said that they felt like airplanes, going. And now it's down to like chirping. It's still there, but,
Now, would you say that because she has some dizziness and the ringing in the ears, was she diagnosed with a condition like Meniere's or something of that, possibly?
No, she had vertigo.
Vertigo.
She has the vertigo, but I live with her. I'm her caregiver, and that is 100%. She has not had one dizzy episode since her adjustment on last Monday.
Wow.
Yeah.
And my age is 88, and I don't feel that way right now. Thank you, doctor.
And then you mentioned something about her walking has improved as well, correct? Her walking?
Yes, her walking has improved, because before she was kind of walking side to side, where now it's a little, she's controlling it because she's afraid, because she doesn't find her footing really well. But normally she's a strong person. She walks well and stuff, but she needed that alignment. And awesome. I recommend it 1,000%. Awesome. And Dr. Trong is great because he spends the time and he listens to what you have and he hears you. So
and I recommend the other people the same way. Next week she's coming again.
Yes, we are definitely recommending people and bringing people to him, because it's they're all in the older age as well. and they have the problem, so we want them to experience what my mom has experienced.
Thank you so much for sharing this information, especially with those who are potentially suffering from similar problems. And there is hope, there is a solution, and I'm hoping Upper Cervical Chiropractic will help them. But obviously it's important for them to at least come in for at least a consult and to see if this is the right type of care for them.
I can't imagine where this would not be helpful to anybody.
Right. Yeah.
No matter what the age.
Right, because I mean, the upper cervical care, what it does, it helps reconnect the brain to the body, and that's, what doesn't the brain control, right? It controls everything. So you're right. It potentially can help a lot of problems.
And there's people that I have a cousin of mine they put her on medication because she would like pass out, and I told her, I said, well, you're vagus nerve. So they gave her medication for that, and I told her, I said, you need to go to this doctor because this is the main blood flow. It's like the airport, the hub of your whole body.
Yeah, Houston control, as I call it.
Yeah.
They not giving nothing the money for sedas, for speak. I speak real clear everything I feel in my body. Que no me pagó para que dijera esto.
She's saying the doctor didn't pay her to say this because she's very upfront and honest, and she's just saying what she feels in her body and how she feels.
Thank you for your time. Thanks, appreciate it.